Excellent. And thank you all so much for coming to our bi-weekly COVID meetup. Feel free to say hi in the chat box. I saw that Christine and Nikki are present from Plains. People have been sharing their masks earlier. So if you want to show people your mask, feel free to, but you don't have to. So for today's agenda, we are going to be doing our 3 deep breaths. I have a couple of questions that have come up from some libraries that I wanted to pose to the larger group about service changes due to COVID. And then I also wanted to talk about COVID testing and false negatives and positives. This was actually a topic that was brought up in the school librarian meetup, but I figured it'd be good to cover in this check-in as well. And I learned a lot when I was researching this. So for our 3 deep breaths, we have this picture here of where I currently am at Birch Lake in Vandalia, Michigan. Population 290, so it's real small. But this is where my roommate's family lives, and this is one of the sunsets at Birch Lake. It's really, really pretty. I totally understand the appeal of waterfront property now. But it's really, really gorgeous, and I just wanted to share this sunset with you all. But let's go ahead and do our 3 deep breaths. If you can sit up straight, open up your shoulders, kind of lift your chest up. You could put your hands at your heart, or you can do cactus arms, whatever's most comfortable, and we'll do 3 deep breaths. So breathe in. And out. In. Out. In. And out. Awesome. So a couple questions to start this meeting. Something that someone had posed to the state library was whether or not anyone had changed library services due to increased COVID cases. So at a certain point, many libraries were closed. Now I know a lot of you are back in the building. Some of you have opened up to the public again, but has anyone gone back to stricter services due to increased COVID, such as returning only to curbside or closing the building to the public, et cetera, et cetera?
This is Michelle, and I'm the one who posed that question because we went back to just curbside only. We are helping, like if somebody brings their own laptop and needs help, we'll go out and sit outside with them and help. But our building is so small, you know.
Yeah, and Connie said we started scheduling in pods, which caused us to decrease hours. And Connie, does that mean that patrons have to sort of schedule an appointment to come, or are you referring to staff podding?
Staff pods. So I'm in pod A, and so I'm in the building with a team of about 12 people, maybe less, from Monday through Friday, and then Monday through Wednesday, and I work Thursday and Friday at home, and the other pod is in the building Thursday through Saturday and working from home the other times. And in order to do that, we had to close a few more hours during the day. So we close in Kalispell, I think about 3 o'clock most days, one day where it's a different schedule. And we do curbside still from 3 to 6. We do curbside all day long if someone wants it, and then also continue to do it until 6 o'clock on those days that we close earlier. So I guess that's it. All the other things were in place before the increase in COVID cases, but that caused us to do this current adjustment.
Okay.
More people are quarantining,
Yeah. Thanks, Connie, for sharing.
Yeah.
Beth said, in Bozeman, we are still open in the morning to 40 people capacity and curbside afternoons, and returns 3 days a week with touchless drop off. Joey says, in Whitefish, we're offering curbside, limited open hours, and at-risk special reservations. And I don't know if any of the other MSL staff want to weigh in. From what I can tell, it seems like, I think especially compared to when we all were sent home in March, I think more libraries are staying open and maybe are reducing hours a little bit, but they're not necessarily closing back down. I think with the mask mandate, I think maybe it's made it a little bit easier to stay open this time with that measure of protection in place. But again, I haven't really heard super specifically from people. Let's see, Kathleen said, we have not changed our hours since we reopened 10 to 2 Monday through Friday with a 10 patron at a time limit. Awesome. And Kathleen, do you mind sharing what library you're at? And then Stacy said, we are open, just require masks and social distancing.
So is anybody having trouble enforcing the masks even though the governor's mandated it?
Yes, in all caps from Connie. And Michelle, yeah, that's been a recurring theme in a lot of the COVID meetups. You know, there's always a section of people who are happy to comply and are totally understanding. And then there's a section of disgruntled people who just want to be butts about it sometimes.
Yeah.
So.
Well, and that's kind of why we went back to the curbside only, because we were requiring masks before the governor made the requirement for the state, and we just, you know, I was providing some, but that gets a little costly. I see Starla says they installed the doorbell, and we did the same thing, but they still just, we've had issues.
We've been lucky in Whitefish that we haven't had much of an issue with anyone not complying with the mask. So
that's good, Joey. I'm glad to hear that. Kathleen also said a lot of people don't like to wear it over their nose.
Yep.
And yes, Connie also agrees. The few times I've been out in public, it's just killed me when I see someone like with a mask on properly and then they like take it off to sneeze. And I'm like, no, that's the opposite of what you're supposed to do.
I feel like this is Connie and Kalispell. I have and Joey, it's interesting to hear that you haven't been feeling any pressure from this, but we're in the same county. You know, we have a very vocal health board member who has been organizing anti-mask rallies. And I feel like in Kalispell in particular, we just have people who are emboldened to challenge us because it's their constitutional right to not wear a mask. And we don't feel like with vulnerable staff, if we couldn't have masks in here, then we'd have to close the building, like you're saying, Michelle. Right. And so we've towed the line because we want to stay open. And, but, you know, we can feel the community sentiment, at least in Kalispell here, like kind of swinging towards a more like openly challenging the directive.
Yeah, well, and with us only having 4 employees and 3 of the 4 of us are in high risk categories, it just, you know, if one of us gets sick, we're going to have to close down completely again because we're all going to get sick.
That is so disappointing to hear you guys have to deal with that, especially, you know, we have other things implemented like shirts and shoes and that type of thing.
Yeah, that is a little bit disheartening. And yeah, Dehanza, you put in the chat box a health professional on your health board. I'm just curious, Connie, if there's
county appointed position. And yeah, she was appointed last year. and had a video go viral too earlier a couple months ago about COVID-19 being listed as a false reason for death on death certificates. So, I mean, not to get everyone embroiled in the political drama here, I'm just seeing the impact of it here at the library, because it makes our jobs a whole lot harder when there's that kind of mobilization going on from a leader.
Right.
I've never met her in person, but I just, I know who she is, and I know that these rallies are happening.
I actually read articles about her this morning.
Oh, I should say where, but I'll just Google it.
I can send it to you. It was on I check our Lake County Public Health Facebook page every day, and somebody was responding to something on there with.
It's good for me to keep an eye on it, because it can help explain a lot, or help me to anticipate what will happen here.
Yeah, thanks so much for sharing, Connie. And I'm glad that you and your library are all on the same page in terms of what you all are comfortable with, but it is disheartening to hear that some people are actively campaigning against that. Let's see, in the chat box, Stacy says, we have free masks available for anyone who forgets their mask. We have a few people that refuse and make it a little uncomfortable. Jan from Livingston says their hours are noon to 6, Monday through Friday. Limited library computer use, 3 stations for people with laptops, tablets, first come, first served, plus curbside pickup and delivery service. Kathleen says, not everyone agrees on how or if masks work, so I'm not surprised or offended about a health professional disagreeing. I know several health professionals who disagree with masks. Heather says, the libraries in Rosebud County are the only departments complying. Besides public health, it is hard to enforce when nobody in our courthouse is wearing masks. And Sydney Richland says, the majority of our county departments do not comply, and that includes key people in our health department. Starla says, it's here too. The city council installed an owl, so their city council meetings look like the council members are in different rooms, no one wearing a mask. Starla, I'm not actually sure what that means. I'm sorry, if you don't mind explaining. I'm not sure what an owl is, or if anyone else knows. And then Jan says, there's only one active case new today in Park County, but we will continue to require masks. So feel free to keep sharing about, Owl is a combo speaker and video device. Okay, they're all sitting at the same table. Oh, I see, but it makes it look like they're in different rooms, and so people can't see the whole room at once. I see. Thank you for explaining that. I'll go into the next question on here, which is, besides quarantining books and materials that are returned to the library, how are people handling book checkouts, reshelving, touching materials, and passing? Do you wear gloves, use hand sanitizer? Do you encourage self-checkout? This is a question from the library, just wondering about that sort of, ephemeral in-passing handling that just kind of happens sometimes. So Joey said, although the city recommended not wearing gloves unless you change them out after each contact with items being checked out, our staff continues to do so when checking materials in. We sanitize the circulation counter after each checkout and use a UV wand. We are still quarantining materials for 72 hours. Kara says, when I pick up my holds from our local library here in Helena, they have already checked them out for us, eliminating that step of using the self-checkout or interacting with CERT staff. Yeah, and I know that the Realm project, the Reopening Archives, Libraries, and Museums, that's looking at how long COVID lasts on different materials in different situations. It's still hard to tell how much infection happens from like objects. I think a lot of the focus seems to be on airborne transmission and, respiratory particles that people are expelling when they're talking or coughing or sneezing or whatever. And so I don't think there's been a whole lot of research about transmission through a book or through something that someone hands off to another person. So that's the other tricky thing. It's kind of hard to, that's still being studied. Kathleen says, our county health department encourages masks, but still identifies closed contact solely on time and distance. You're considered a close contact if you are within 6 feet for 15 minutes or more, regardless of whether you or the other person or both are wearing masks. The Plains Library says all check-ins are through the book drop, 1 pair of gloves per patron, and we wipe down after every transaction. Kathleen says our staff in Belgrade is required to wear gloves and disinfect gloves between each patron. So yeah, it seems like there's a variety of policies around this. So in general, it seems like people are trying to minimize direct contact. Let's see, Kathleen said we eliminated our self-checkout for now so that we wouldn't have to keep track of disinfecting it between each patron. And then Michelle also asked, how long are you all letting people stay in the library? And Michelle, in past meetups, a lot of people, a going time limit seemed to be about 30 minutes. I'm not sure if that's still in place for people. Oh, yep, it looks like 30 minutes still is.
Because in Whitefish, tables, community room, etc., are still unavailable, I have found that most people come in, get their materials, and then leave.
Mm-hmm. Oh, so they're not even running up against a time limit. They're like in and out.
Nope.
Mm-hmm.
So I just wonder, because of the, as mentioned earlier in one of those comments, the close contact being within 6 feet for 15 minutes, 30 minutes seems, I hate to say long, because, I've had people in the library for hours and hours and hours in the past. It just.
Yeah. And Michelle, if you look in the chat box, it looks like a lot of people are doing 30 minutes for computer use. Some people are doing an hour because it's hard to get everything done just in 30 minutes. But yeah, I think that's what I remember hearing when people were talking about time limits in a previous session. And I think that's probably the same case. Jan says no time limit in Livingston, but also no chairs or tables, so no lounging happening. Connie says our computers are spaced and have plexiglass. And Beth says we have people who cannot get to the library during the 3 days we're open for returns. I just give them my address and tell them to throw the materials on my front porch. And then Connie says for the computers, it's only at half capacity from 12 to 6 stations. And then Beth said a lot of people are still staying home for weeks at a time. So any questions or further comments on this slide? And again, as a reminder, there is the services map on the MSL website that you can take a look at to see what people's hours are, what services they're offering, and to get an overview of what public libraries in Montana are doing. That is only accurate as so far as directors have self-reported. So some people have updated their entry, throughout the pandemic, and others haven't yet done that. So just make sure to look at the date and you'll get an idea of how updated a library entry is. And then Joey asked, Connie, are you reserving computer time? And then Jennifer asked, where is that again? And give me a second and I will grab that link for you all. And it's just on the Montana State Library homepage. There is a red banner that you can click on at the top. I will also drop it into the chat box. And then Joey said, we thought about reserving computer time, but never have lines. So it's just first come, first served. We also offer laptops to use on the porch. Awesome. Okay, so let's go ahead and move on. If you do have any other comments on this, please feel free to stick something into the chat box and I can address that. And Michelle said, will you also resend us the link to update the map, please? And yes, I can do that. Maybe if Pam, Suzanne, Kara, or any MSL folks on the call could find that and stick that into the chat box, that would be great. Pam is on the job. Thanks, Pam. And once you update, and Pam's going to send out the link to the survey. Once you fill out the survey again, updating your library's status, the map should automatically update it on the story map. So you don't need to like check and make sure. It should automatically slot the newest information in. Okay. So this next part is, again, this wasn't something that was brought up in this
Amelia,
series of COVID. Oh,
just before you
yeah.
go on, I was just talking to Jessica this morning about that map, and she told me it's not actually real time, that she has to do a little manual. So if you don't see it right away, wait a day. She gets to those every day. So I didn't know that, so
Okay.
I thought I would just jump in.
Awesome. Thanks for letting me know, Joe. So I retract my previous statement. It will update, but it's not automatic. There needs to be some human interfacing, but it should be updated fairly soon after you submit it. It sounds like Jessica does do it every day. And if you find that it's not updating, contact one of us and we can figure out what's going wonky. Okay, so this next part is about COVID testing. And again, this came up in the school librarian meetup, and I figured I'd just cover it in here because there was a lot of information that I didn't know about. And I'm not sure how often you all are getting asked about testing or whether you just have these questions personally, but I thought it just might be useful information for people to know. So when I was looking into this, there are 3 types of tests that were talked about. There is viral testing, antibody testing, and antigen testing. Viral and antibody testing have been around longer. The antigen testing is fairly new on the scene, and I think it was very recently approved by the FDA as like a testing method. But the viral and the antibody testing seem to be more common. So viral testing will tell you if you have a current infection. So that's when they usually do a deep nasal swab or a throat swab. They're trying to get a respiratory system sample, and then they test that for the virus. The most common viral test method is detecting genetic material from the specific SARS-CoV-19 virus. So they do whatever they do to detect the genetic material, and then if it comes back positive, then they know that you have a current infection. Antibody tests, they might tell you if you had a past infection. So for antibody tests, they usually do a blood test for this, and then they look for antibodies, which is a protein that your body makes to fight off infections. And so since antibodies are disease specific, if they find the specific COVID antibody in your blood, then they can deduce, oh, this person had COVID in the past. You also might have COVID currently, but it's usually used to confirm a past infection. It's not a good method to diagnose current COVID infections because it can sometimes take 1 to 3 weeks after any infection for your body to make antibodies. So if you do an antibody test during that time period, you could come back with like oh, you don't have COVID, but you actually do. It's just your body hasn't reacted yet and it's a little delayed. So this test might give you a false negative and say that you don't have COVID when you actually do. And again, antigen testing is more recently approved. It's a much quicker test, which is why I think it's become a bigger player in the testing scene. I'm not sure how long antibody or viral testing takes, but I think it requires more equipment and more time and more skill. Antigen testing is much quicker. They say it can be run in some cases in about 15 minutes without super specialized equipment. I didn't look super closely into this, but it apparently uses technology similar to like a pregnancy test or a rapid strep test. So they're looking for molecules and proteins that are on the surface of the virus rather than genetic material like the viral test does. So it's quick, but it's not as accurate. But this one is also used to test for current infection. So those are the three main testing players that I've seen for COVID. The main thing is just to remember that viral tests and antigen tests are used to make current diagnoses of COVID, and then antibody tests are used to see if someone was previously infected in the past. So hopefully I explained that well. This next part, specific versus sensitive, this is regarding test accuracy. And so it's not as simple as like this test is very accurate or this test is not. There's these two specific traits, specificity and sensitivity, that make up a test accuracy rating. So when a test is sensitive, sensitivity is the test's ability to correctly show positive results. So person McPerson gets a test and they do have the virus, and the test comes back and says, yes, this person has the virus. Specificity is the test's ability to correctly show negative results. So person McPerson doesn't have the virus. They go in and get a test, and the test says, congrats, you don't have the virus. So again, I put here sensitive equals positive accurate, specific equals negative accurate. In general, people are concerned about false negative tests because that can, it's someone who has the virus, but they're told because their test came back negative, you're fine, you don't have the virus. And then they go out and do their thing and could potentially spread the virus further. So that's what people seem to be concerned about when they're talking about test accuracy. They do talk about false positives because, that kind of is hard on the individual who has to quarantine themselves or whatever, and then they find out later, oh, I didn't actually have the virus. But that's more on an individual level, whereas the false negative has the potential to affect many people. So if you poke around about test accuracy, you'll hear a lot about false negatives because that has the potential to affect more people. So viral tests are they're highly specific because they're looking at specific genetic COVID material. So if you get a positive test back from a viral test, you can be very sure that it is a true positive. However, it's not very sensitive, and it often gives false negatives. This is not necessarily because of the test itself. There are many reasons why a false negative might happen. This can happen because the test is done imperfectly. Any sort of contaminant in the sample can throw the test and bring back a false negative, especially since they're testing for such small, specific genetic material. If the patient is in the early stages of infection, I think this is just for any test, then there's just not enough viral load in their respiratory system for anything to pick it up. So if you test someone who's in the very beginning stages of COVID, or maybe they're partially recovered, there's just not enough on the sample for the test to come back positive. And that's why, you've probably heard if you have COVID symptoms, you should act like you're infected, even if you get a negative test. Because in some cases, they've had to test people repeatedly until they get a positive test back because of a myriad of these factors. When I was looking into false negative rates for the viral test, that had a pretty wide range. It ranged from 2 to 29%. And again, that happens because of the reasons I mentioned above with contamination or with just human error or wherever the person is in their COVID infection. But it's also because things are so new with COVID as well. They're still researching this disease and they're still researching methods of testing and all of that. And it's hard to definitively say what the false negative or false positive rate is just because not enough time has passed. So that's another thing to keep in mind. With other tests that you have for diseases, there's a lot of confidence behind them because there's just been a lot of time. And these things have consistently performed year after year at these levels. And so that's why they're able to confidently say, this is a very accurate test or this isn't. Just keep in mind with COVID, we haven't had that time. They do agree though that rates for false positives is 5%. So that's why they say for viral tests, if you get a positive, you have COVID. And let's see. So that's stuff about the viral test. For the antibody tests, those have a wide range of accuracy. False negatives have been reported, and there's not consensus on the rate of false negatives either. Some research has shown that antibody levels can decrease after a few months. So if you test someone right after they've had it, then they'll have lots of antibodies in their blood, but maybe 6 months out, they just won't have as many. And that can affect the test as well. So there's still a lot of research being done about that. And then with the antigen tests, they have a high false negative rate, as high as 50% in some cases. Again, since this is a new test, that might improve with more research. And some people do use the antigen tests just because it's so much quicker and you get things back in a much more timely manner. But they say you should do repeated testing with this. Don't just go off of one test. And with repeated testing, that can help increase the odds of getting a more accurate result. Again, though, it's hard to know exact accuracy rates because this is also new and there's constant research being done. And we're also still learning about the disease itself. So it's very much a developing situation. And it's also important to remember with any test, not just COVID, but with anything, there is no 100% method. Just in some of the research that I did, I think in some of the just the more like forums or conversations that people were happening, people were just like, I just want an answer. And unfortunately, it depends. There is no magic bullet, 100% thing that this will work all the time. So just keep that in mind. And I did include this graphic here to kind of, I mean, I still get like all of this a little bit confused because there's a lot of different terms here. But you can see here that the COVID swab test is highly specific, but not as sensitive. So again, the positive result is almost always true, but a negative result is sometimes false. So you can see how that ends up in this graphic with the true positives and then the false negatives. So feel free to, I sometimes have to look at this graphic and be like, okay, that's what this means. That's what all that is. And then on this next slide, I have some recommended reading. These were some links that I thought summarized things very clearly, and they linked to other reputable sources from them. So I'll go ahead and put these. Connie says, so false positives are not artificially increasing infection numbers. No, with the viral testing, if it comes back positive, it's pretty sure that you are positive. It's more the false negatives that people are concerned about. That seems to be happening more as opposed to false positives, from what I've read. Let me go ahead and.
Yet I had
put
somebody come
these-
into the library one day and they said somebody came into their business, or one of the employees didn't feel good. So they sent him to get a test. They tested positive. She went, or he or she, they went to the doctor and they said, you don't have COVID, you have a cold. So there was one positive test. So then everybody else had to come get tested. And everybody came back positive, and then they received a letter that said these were lab contaminated samples, that you did not test positive. So if it happened once, it can happen again.
Yeah,
Because
definitely.
these people had
And
been
think,
off work for over 4 weeks because of the very first false positive.
Where
mhm.
was that?
I don't understand the stats exactly.
Yeah, and I mean, that definitely happens. I mean, all of the articles and things that I read talked about human error. And I didn't look too closely into the exact process of like, how do you take a nasal swab and actually do the viral test? The most that I read into it is what they were testing for. So I don't know what the like actual logistical process of testing the nasal swab is like, and how much room for error is in that process, and you know how much training people receive, et cetera, et cetera. And I think also right now a lot of testing facilities and labs are pretty swamped, so there's room for error there as well. I did also read something called pooled testing, and instead of testing each nasal swab individually, they'll somehow combine everything together. And if there's something that's positive in that batch, then they will go through and test things individually. But if there's not something that comes back positive in that batch, then they won't go through and individually test. That's not it. I think it varies by lab though. And there's also multiple viral tests available. So, there's like the general brand of like hand sanitizer, but then you could buy Germ-X or Purell or whatever. So different pharmaceutical companies are manufacturing different viral tests. And there's differences in accuracy between those tests as well. Let's see. So questions. Jennifer said, oh, can you talk about this zebra mussels article? Yeah, so that one was from NPR, and it was just an interesting look at, I think, the false positive testing. And apparently back when zebra mussels were a big problem as an invasive species, what some biologists were doing is they would take water samples and they would test for the specific genetic material that zebra mussels would shed into the water. And so they would test for that, and all of these areas were coming back positive, but they couldn't actually find evidence of the zebra mussels. So they were looking at that whole process and wondering what it was that was causing these tests to be positive, even though there wasn't, zebra mussels weren't there in the water. And that whole like testing for genetic material is the basis behind the viral testing. So it talks a little bit about that. That article is from, I think, June 15th. And again, this is a developing situation. And if you look at I think the Harvard Medical blog and the MIT blog, both of those were super helpful to me in terms of like just high level understanding of testing. You can see that certain questions have been updated and have like an update date of August. Some of them have not been updated since April. So I would recommend looking at dates when you are looking at articles and research on this topic, because new stuff is coming out all the time. Starla said some of the poor counties aren't testing at all. They are putting on the treatment form, probable mild case of COVID. Yeah, and I wouldn't be surprised if that's happening in other places as well outside of Montana. I think in some cases too, people are getting the nasal swab, but they're not getting results back because the labs themselves are overwhelmed. And then Beth said that test of large groups allows for quicker returns of results. Yes, the pooled testing. So yeah, sorry, that was a lot of me talking and a lot of information that I threw at you all. Feel free to let me know if you have any questions. I think I'll periodically kind of look up this topic just to see what else is generated on this. But again, it's very much growing and changing and developing. So any questions about that?
I, for one, want to thank you, Amelia. This is Joe, that I don't have to read the Harvard Health blog because you so graciously did that for us. So thank you.
Yeah, no problem. But the MIT blog and the Harvard Medical blog and the CDC page are very great about explaining things and explaining what's out there. And you know, it was very informative to me, and I was like, oh, this is good just to know in these times. So, all right, moving onwards. Just a few last resources to share with you all. I wanted to draw your attention to the Hotspot Lending Program webpage. I know that some of you have probably seen this, but if you haven't, this is, for those of you who are getting hotspots from the State Library, this has all the information on example circulation policies that you can use, frequently asked questions, forms that you can adapt or download, how to report and troubleshoot issues, et cetera, et cetera. So if you have a question about your hotspot lending program, you're of course more than welcome to reach out to us, but we would encourage you to look at the webpage first because, well, at the beginning we were missing a lot of information, but as more and more people ask questions, we added stuff to the webpage to make it more comprehensive. So let me grab that link and stick that in there.
And this is Joe, and we are planning to have a kind of webinar. I've been talking to a couple libraries about what they're doing with their hotspots. And so if you have some examples of how you're using them, I'd really like to hear from you because we'd like to put together a little panel of presenters to talk about how they're using them. That might give some of the rest of you guys some ideas.
Yeah, that sounds great. Thanks, Joe. And this last thing on here is from the Wyoming State Library, and it's these mask up posters for your library. So if you're looking for some marketing and PR things about wearing masks, these are some great simple graphics that you can use to put in your library. And you can just download the images and print them out and post them up if you want. Okay, and that's all the stuff from me. We have about 10 minutes left. You're more than welcome to stick around. I wasn't sure if there were just kind of general topics that you all wanted to talk about and bring forth to your peers. But if you need to head out, thanks for coming, and please do reach out if you have any other questions or other resources to share too. I'm always looking for those. But yeah, now's the time just for general questions, follow up, other issues or topics that have come up around COVID. Oh, and Dehanza said we had a local artist pass similar posters out for free. Oh, that's nice. Ah, I love it when local artists do things like that. That's great.
And I will say Beth also mentioned that being the awesome cataloger she is, she put a link to the electronic survey in the hotspot record so people can find it there too.
Oh, awesome. Yay, Beth. See, any other comments? I might go ahead and stop sharing my screen. Beth asked, have you heard anything about phase 3 in Helena? Oh, there was a press conference thing from the governor, wasn't there? I don't remember. I did not watch that. But I don't think he talked about moving into phase 3 or anything like that.
Yeah, I don't think there was a phase 3 thing.
No,
Yeah.
he just talked about schools and
Right.
sports and all that kind of stuff.
Yeah, yeah.
Okay, okay.
No word on phase 3, but then we still got lots of cases, and Yellowstone County is leading the
Yeah,
way.
man,
Yay!
you guys are really climbing.
We're rocking it. We got like half the cases. Woohoo!
Oh my gosh.
That's not the prize you want.
No.
Susan.
That's exactly where you don't want to be number one, you know.
Oh, Kathleen has a question. I'm curious, what policies do other libraries have about requiring or not requiring staff to wear masks while the building is closed to the public?
This is Connie in Kalispell. We have staff wearing masks the entire time they're here, unless they're in a closed office like I am, the only person actually who has an office where I can close the doors. But also, if there's not going to be anyone in your area and you have plexiglass around your desk, then that's okay. But we have a very undersized building like several libraries, and you can't really ensure social distancing or plexiglass. So we have folks wearing masks, having mask breaks and things like that, but wearing them while they're in the building.
Thanks for sharing, Connie. A couple other things. Heather says we don't require it when not open, but there's only 4 on staff and can spread out. Starla says we require masks at all times. The idea is not to infect areas. I don't know, Kathleen, I don't know if anyone has I haven't seen like a written policy. All the policies that libraries have shared with us have been for patrons.
We have not a policy, this is Connie again, but we have a reopening plan with all of the safety precautions for staff and expectations.
Okay.
Written out.
Okay, cool. So Kalispell has it written down. I think other places, maybe it's written, I'm not sure actually. Maybe it was just something that was decided among the staff as well. And Kathleen said, since we are part of the city, we follow their guidelines. I was just curious about others. Yeah, it's always good to know what other people are doing, seeing what other people have going on. Any other questions, or also any other topics that you all are curious about that you want more information on? I'm happy to do more research and take a look at what's out there. Or I can just choose stuff too and bring that forth.
Great job with all the info on testing.
Oh, for sure, yeah.
I have a question. I'm still unclear about how local hospitals will be impacted by the changing CDC guidelines and reporting, and how that will impact us as we try to watch the numbers and understand what's going on in real time. And then also, is there, I mean, in the very beginning, I know Montana State Library staff and several of us said, like, CDC is the place to go, keep referring people to that. Now that there's been such a change in management at CDC, I see information coming out that's much more conservative on predicting how the virus will go. And I'm just wondering if there's another place that is considered to be like the new place for the most up-to-date information. I'm saying that too because there's just released the report that only 6% of COVID-related deaths had no comorbidity. And so I've already heard a few community members quote that and say that means only 9,000 people died of COVID. So there's some confusion around the new information CDC is putting out. I'm just wondering if you have any insight or other resources.
So let's see. For the hospital reporting system, I don't know much beyond the hospitals are still adjusting to that. And so a lot of the information is just kind of muddied. And it's unclear as to whether or not that's because of the system itself and just the natural growing pains that happen with transitioning from one system to the next. Whether the system is like actually good at what it's supposed to be designed to do, or whether there is any sort of like screening of information or all of that stuff. So I think at this point, there's really hasn't been a whole lot of, the transition has not been great, and there hasn't been a whole lot of guidance from the White House to the hospitals. But I think how things are affected won't really come up until a little bit later. In general, the consensus is that the transition is not great, and the timing is bad, and no great reasons were given as to why we had to switch from the CDC reporting hospital system to this White House hospital reporting system. However, that hospital reporting system that data is different from just straight case data. I am not sure about the CDC case numbers. I think they said that for case numbers, things like the Johns Hopkins map are still reliable because they are getting that information directly from like state departments, health departments. And that's just in terms of like number of cases, number of tests, number of deaths, a number of active cases, that sort of thing. So they said that those maps are still reliable and those are still reliable sources of information. In terms of the reports that are coming out, I have not heard a whole lot about that. So I will actually put that on my list of things to research. But with the hospital data, there is a lot of concern about the quality of that and the delay, because there is a delay now at this point, just because that's sort of the kind of the benchmark in terms of, the hospital data provides how many ICU beds are available, how many things, or how many people have active cases in hospitals and things. And so it gives a better idea of how people are responding to COVID and how under control it is, as opposed to just a straight case number and active cases and deaths and number tested. So that's what I know from the research that I have done. But I can definitely look into reporting and also how the CDC policies have changed. I do think this is kind of anecdotal, but I do think that some of the policy changes at the CDC have happened because of budgeting stuff. I mean, the CDC's budget is controlled by Congress, and I think in order to accomplish the other things that they want to do, I think they were voluntold to do other things regarding how they collect or present data. But that's just a feeling I have. So don't quote that. I'll have to go and find actual research to see what is actually going on. Kathleen said, Beth said that the World Health Organization is another potential source of information. And then Kathleen said, according to a library webinar I took recently, the CDC gets almost all of its information directly from the states as well. So I think in terms of case count and things like that, the CDC is still probably pretty reliable. Funnily enough, just thinking back on where I look for case counts and stuff, I look at the Johns Hopkins map and I look at the Montana case map. So I haven't gone to the CDC for that information. I usually go to the CDC for, looking at the testing information, the symptoms and that sort of thing. So, Pam very helpfully included the World Health Organization COVID link. So that is another potential information source to explore. But I will look into that and I'll talk about that at the next meeting. So thanks, Connie, for your question. And then Kathleen said, state and local level health departments will likely have the most up-to-date numbers, as it takes a while to pass that information along to the CDC and other sources. And yeah, that's a really good point. There's always a bit of a delay as information gets passed from the state to federal level. Any other questions? And just as a reminder, you can save the chat if you'd like to. If you go into your chat window, next to the type message here, there's a to everyone and a file button and a little ellipse menu, the ... If you click on the ... you can save the chat and have the transcript. I'm going to go ahead and stop the recording.